Hello, everybody. Going to go over the PowerPoint that goes with Chapter 13, the role of quality, providing patient value while achieving quality, safety, and cost effectiveness. Much more difficult than it sounds. So this chapter, we're going to focus on some issues, starting with quality, talk about safety. Quality is key. The most important priorities in healthcare system are, number one, determine what the patient wants and values. Number two, provide safe, loving, quality care. And number three, improve care delivery in a cost-effective way, which is not always very easy. So these goals must be met by staff and healthcare providers to receive adequate reimbursement. And we're going to talk a little bit about how that comes into play. So just as far as overall goals in regard to quality, we want to provide the best quality care in order to keep patients safe. Quality, safety. That's what we're talking about in this PowerPoint. Providing the best quality care in a cost-effective way. Quality, safety with cost effectiveness. And that is the key there. So some problems that we must address. We have a long way to go to fix our healthcare system. I don't think anybody would dispute that. So number one, what should we address? Poor healthcare outcomes in the United States. So despite the fact that we have the highest costs, approximately $3.8 trillion annually, and with that, we have some of the worst healthcare outcomes worldwide. That's a problem. Highest costs, poorest outcomes. We want good outcomes, low cost. So these include, some of these outcomes include, number one, life expectancy rates. Ours are lower in comparison to other countries. Number two, suicide rates. Ours are higher than other countries. Number three, obesity. 40% of our population in the United States is obese. And another problem that we have that attributes to poor healthcare outcomes is we have fewer practicing physicians. So some patient safety issues, and what occurs is unintentional harm. So with these issues that we're going to talk about, the outcome here is unintentional harm. That's common, and that's something we want to address. Number one, medication errors. So the Institute of Medicine estimated approximately 98,000 hospital deaths every year due to medical errors. So medication errors were the 8th leading cause of death in America. It's pretty staggering. Number two, healthcare-associated infections. Healthcare-associated infections are associated with about 90,000 deaths, with an annual direct medical cost between $28 and $45 billion. Another major problem that we have. Number three, falls. There's a high correlation with falls and cost, and falls are increasing with a direct cost of about $50 billion a year due to falls of patients. Number four, missed care. So when we talk about missed care, this becomes very costly and leads to complications, maybe delayed care, missed care, partially completed care, or maybe care that wasn't completed at all. Any of those would be considered missed care. Disparity issues is another problem. And significant healthcare access continues to be a major problem in healthcare, and there are disparities that exist, which we'll talk a little bit more about. Cultural issues, ethnocentrism of healthcare workers, cultural differences among healthcare professionals. So patients are becoming more diverse, and often healthcare workers in many places are becoming very, very diverse. And these differences are not recognized. We're not recognizing and dealing with these changes in culture in regard to the patient and healthcare providers and workers. Next, workforce management issues, effects of budget cuts on nurse satisfaction rates. So when nursing budgets are cut, studies have shown that the dissatisfaction rate of nurses increases fourfold. So budget cuts have a direct effect on nurse satisfaction rates. Effects of understaffing on patient outcomes. So nurses staffing, the percentage of staff that are RNs versus LPNs or LVNs. Another factor would be RNs' years of experience. All of those affect patient safety. They all affect nursing outcomes. And the less staffing we have, the less RNs we have, the less experienced RNs we have, the more infections. There's a direct correlations to more infections, more wounds, more medical errors. So it's a high correlation with that. Employee issues. The OSHA, which is Occupational Safety and Health Standards for Employee Safety. So OSHA provides nationally mandated standards for the workplace, okay, for the workplace for employee safety to ensure safe and healthy working conditions. Okay, sorry, working conditions. Some common violations as far as violating OSHA standards, which makes a workplace not as healthy. Failing to train workers on bloodborne pathogens, that's actually the most common violation that is seen for healthcare facilities. Reporting fatalities and injuries is the next one. Just using general protective equipment, personal protective equipment. General electrical requirements as far as how we plug everything in and use extension cords, and these are just common violations. There's definitely more, but it's important to understand that this OSHA provides standards in the workplace. Promoting healthy workplace. So administrators are responsible for maintaining a safe environment for the staff and the patients. This can include what we just talked about: infectious disease, bloodborne pathogens, falls, fatalities, PPE, electrical equipment. It also includes violence, security. So administrators are responsible to promote a healthy workplace. The next one, disaster planning and preparedness. Facilities need to be prepared to deal with disasters. This actually became more evident after 9/11 and then most recently after the COVID-19 pandemic. And even if a hospital is impacted like they were with COVID-19, they're still responsible to have disaster planning and preparedness in place and to embark on it when needed. Okay, so our reality is changing, ready or not. So nurses can change healthcare, and nurses can do it by a few ways. Number one, finding out what patients want and value. So nurses are with patients far more than any provider, whether it's a physician or a PA or a APRN. So nurses can definitely play a role in understanding and seeking out what a patient wants and values. And I think we know mostly what it is. They want somebody to respond to their needs, and sometimes even that basic need is not met in some of the facilities in different areas. Next, communicating with linear administrators to assure patients' needs are met. So to assure that there's staffing and that the staff is protected and the staff is safe. Preparing for changes in healthcare. There's just going to be changes in healthcare, and we have to be prepared and not fight it. And to be able to prepare for these changes is going to require leadership, it's going to require planning, it's going to require change management, and these have to continually be going on for this reason. Strategies presented by the American Hospital Association in Hospitals and Care Systems of the Future. There's 4 priorities in regard for this American Hospital Associations to help, for strategies to help, trying to say here, it's just kind of help with changes in healthcare and doing them cost effectively and efficiently. Number 1, seamless patient care amongst all the disciplines. We try to do that, and you see that sometimes the right hand doesn't know what the left hand is doing. Number 2, use of evidence-based practice to improve quality of care. So evidence-based practice that occurs and new information evolves. We need to change our policies and our procedures to improve our quality of care and reflect the new evidence-based practice data. Number 3, improved efficiency. Inefficiency is rampant, and it contributes to significant healthcare costs. Number 4, development of integrated information systems. Technology has to be affected. These information systems have to be integrated, so nursing and providers and the other disciplines can all access the same information system. Okay, so the next one here, the impact of quality on healthcare, regulatory response, restricting or eliminating reimbursement. So we're going to talk about some regulation that's required, and a facility, or whether it's inpatient or outpatient, has to follow these regulatory and restrictions, or they don't get reimbursed. So the first one, hospitals, acute care facilities must demonstrate compliance to receive the highest possible reimbursement. And if they don't, then they don't receive reimbursement. So patient care paths are implemented, so none of these steps are forgotten. And there's just a process that we have to go through to check off boxes to assure that these are being met, so we can get, the hospitals and healthcare facilities can get reimbursement. Hospital inpatient quality reporting program is something that has to be done as well. So there's certain things that can occur and would prevent a facility reimbursement. So for example, antibiotics must be given within a certain period of time frame for pneumonia. And if it's not, then the hospital doesn't get reimbursed from the insurance company. So timeliness matters. So these quality reporting programs and patient care paths are helpful for something like that. Anything that is a hospital-acquired condition, if somebody gets a bed sore or an air embolism, or there was a mistake with giving blood and there was a blood incompatibility, and somebody fell and somebody has a catheter-associated urinary tract infection, those types of hospital-acquired conditions, no reimbursement. Home health, they have their own set of quality measures. Long-term care, nursing home quality measures. So there are reasons for quality measures that are required for a nursing home. Nursing home quality measures provide information about quality of nursing home care. Okay, so they have their own sets of boxes and care paths and planning programs. Provides information about the quality of care where the patient resides. provides information to facilitate discussions about quality of care with nursing home staff, and provides nursing homes with quality data. So these are reasons why there has to be quality measures in a nursing home. Post-acute care, unsafe transitions, so reduce care fragmentation to reduce unsafe transitions of somebody leaving an acute care facility and going to a post-acute care, and then sometimes the care is just not continued. It becomes very fragmented and not seamless. And also there are enhancements to care provided for end-stage renal disease patients to be sure that they're cared for properly, which is something that's very common in these post-acute cares. Quality reporting system mandate. The Joint Commission implemented a national patient safety goals for accredited facilities, which is mandated by the federal government and legislation, and they must demonstrate compliance to maintain their accreditation standard. These patient safety goals include identifying a patient correctly, improving staff communication, which we all know it just can become very fragmented, using medication safely, using alarms safely, preventing infection, identifying patient safety risks, preventing mistakes in surgery, quality safety, quality safety. So those are all mandated, and if the hospitals and facilities don't maintain these or demonstrate compliance in these areas, then they lose their accreditation standard. Okay, thank you.